My name is Britta Vegting and I'm a medical doctor and PhD candidate at Erasmus University Medical Center Rotterdam in the Department of Gastroenterology and Hepatology. I'm the first author of the paper Environmental Footprint of Gastrointestinal Endoscopy Services, a Systematic Review, published in Endoscopy. This work was conducted together with my co-authors Demi Gerritsen, Ceyda Izci, Nicole Hunveld, Erik van Rij, Wilco van den Heuvel, Pieter Jan de Jonge, and Peter Siersema. Our research group is specialized in environmental research and brings together expertise from medical design, sustainable procurement, and clinical practice, a combination that allows us to approach sustainability questions in a truly interdisciplinary way. The environmental impact of healthcare is high, and endoscopy contributes to this impact as the third largest emitter. Endoscopy is an essential diagnostic and therapeutic service, but it is also resource intensive with high procedure volumes, energy use, and reliance on single-use products. Yet, the true environmental impact of endoscopy services has not been systematically quantified. Our motivation was to bring together all available data, to identify the main contributors to emissions, and to highlight knowledge gaps that need to be addressed to make endoscopy more sustainable. We identified 28 studies assessing the environmental footprint of endoscopy services. Most studies focused on carbon emissions, and few looked beyond greenhouse gases alone. Across studies, we found that patient travel, energy use, and single-use products are the dominant contributors to emissions, while waste, perhaps surprisingly, plays a much smaller role. The total emissions per endoscopy procedures ranged widely between studies, from 5 to 73 kilograms carbon dioxide equivalents. These differences in outcomes are largely due to differences in measurement approaches. And this variability shows that the evidence base is still fragmented and that standardized assessment methods are urgently needed. Understanding the emission hotspots can guide hospitals towards the most impactful sustainability interventions, such as reducing unnecessary travel, optimizing energy use, and re-evaluating single-use products. Our next step is to develop a framework for implementing sustainability interventions in endoscopy departments, starting in the Rotterdam region. We also advocate for harmonized life cycle assessments and adoption of the Izci new eSPARE reporting criteria to improve consistency and transparency in future research. And finally, we want to turn data into action by collaborating with clinicians, hospital managers, and industry partners to reduce the environmental impact of endoscopy services. In short, this systematic review provides a comprehensive overview of studies that have quantified the environmental impact of endoscopy services. The review shows that we do not yet have an accepted standard approach to assess that environmental impact, and in our paper, we propose a way forward to come to a more standardized approach. We hope it supports clinicians, researchers, and policymakers in transitioning toward low-carbon sustainable endoscopy. We thank Endoscopy for the opportunity to share our work.